So just briefly, I know surgery is kind of thought of as, memory is one of the big concerns for people post-surgery, but there actually has been documentation of memory problems and other cognitive problems even before surgery. But after treatment, and so there's different types of treatment, and I have a cursory understanding of all of the details of all of these, but some of the, so there's different surgical procedures, transcallosal being one of the more common, and so there's mixed evidence on cognitive outcomes, specifically regarding memory after these surgeries. So even things with IQ declines and things like that are more consistent, but with memory, a lot of the studies show some people improved, some people declined, some people stayed where they were, and so the information is kind of mixed, and part of that I think is related to how people are measuring memory and things like that, because again, there's a lot of different components, but with more invasive procedures like that, you do tend to see more memory impairments, greater frequency of cognitive impairment post-surgery than with some of the less invasive techniques like the lasers and all of that. The interstitial radiotherapy, where they actually like inject in there, is also mixed. So there's not as many studies looking at that, but it's the same type of thing as with more of the traditional surgical approaches, where you get some improvement, some decline. It's very mixed. With the stereotactic laser ablation that we do here, there's really, so it's it's a much newer procedure, and so when we're looking at cognitive impact post-intervention, we want to look at immediately afterwards, but then also several years afterwards. And so a lot of that research is just now starting to come out, where they're having enough people to be able to look at these cognitive deficits and cognitive outcome long term. But in looking at use of these types of techniques in other populations, so not just hypothalamic hamartoma, but even brain tumors and other types of populations, adult populations where they've used this, there really is minimal risk of memory dysfunction compared to the more invasive approaches. And so one of the first reports that actually Dr. Curry published in 2012, when he was kind of reporting on some of the first patients that he had treated with this, only 1 in 5 had kind of transient but non-disabling memory problems, and those tended to get better. And really, that's kind of the theme in a lot of this research, where you see a few things in a couple people shortly thereafter, but it's much better than the outcome in some of the other more invasive procedures. And you also have to, in talking about transient memory problems, right after surgery, there's a lot of other things going on in the brain that can affect memory or your perception of memory. So attention is like the first step in memory, and so if you're still in that kind of post-recovery period from surgery, attention is very likely to be impacted too. And if you can't pay attention to something, you can't remember it. And so there's a lot of other things to be thinking about in that post-surgical period that can impact memory functioning. Some factors influencing cognitive outcomes, so who's more likely to have cognitive problems after surgery. We know that the size of the lesion, and this is across just different types of interventions, but the size of the lesion can have an impact. So one study actually showed that lesions below 1 centimeter in volume did not have cognitive or behavioral consequences after surgery. So a couple of other studies have shown that of all the factors they looked at that may impact cognitive functioning, that size, volume of the tumor was actually showed the strongest correlation with cognitive impairments. And as far as location, so type or location of the lesion, really that's So some of them are more intrahypothalamic, and those tend to be, because they're kind of enveloped in the hypothalamus and can be pushing on the third ventricle, those you tend to see more poorer cognitive outcomes with those types of tumors rather than like the pedunculated kind. So ones that are kind of more like tightly wrapped around the hypothalamus and end up pushing on the third ventricle, and so kind of creating, they're a little bit more invasive. They're pushing on structures and all of that, and so they're harder to get out because they're more tightly wound in, and you tend to see more cognitive deficits with that as opposed to ones that are kind of pedunculated and a little bit more separate from. So as far as duration of seizures and even kind of age of onset, which those two are highly connected, but that has been shown in some studies too, that a younger age and shorter duration of symptoms is associated with better cognitive outcome. That hasn't always been shown, but that's something that's being looked at. And then preoperative cognitive functioning. So here at our center, we do neuropsych testing before they get the surgery and then after. And so looking at preoperative cognitive functioning, so it's kind of like the stronger you start out with, so you have this kind of reserve, but what's been shown is that people that have better memory functioning before the surgery are to have a higher risk of performance decline. Whereas patients who were lower functioning prior to surgery, there are more reports of improvement after, and this is also improvements in IQ and just kind of general overall improvements. Now there have been some studies looking at that there's almost a bias a little bit in this, because if you start out higher functioning and you're more likely to notice a decline. So if you started out, high average, superior range functioning, and you're down to average now, so you're still kind of within normal limits as far as what we think of in terms of cognitive testing, but that is a bigger difference to that person. And so there's those kinds of factors that can go into as well, but it has been pretty consistently shown that higher preoperative cognitive functioning is a risk factor for more declines afterwards. So just to go through kind of real quick the structures that are important in memory. So the temporal lobe and the hippocampus are all very important. And so you can kind of see, I have a pointer up here, but the teal section in the middle there is the hypothalamus, and then right below it are the mammillary bodies and the amygdala and the fornix and the hippocampus. All of those structures are very, very important for memory at all different stages. And so you can see that the hypothalamus is kind of right in the middle of all of that. And so that's why memory problems tend to be a really big concern, for good reason, because it's right in there, right in the middle of where all of the memory stuff is happening in the brain. Just real quick, kind of the stages of memory processing. So first, registration. So first you have to, see what's going on in the environment, whether it's sound, sights, whatever it is. And so that's where that attention piece comes in. If you're not paying attention to what's going on, it's not even going to get registered. But so that's kind of an important precursor. And then encoding is, okay, so you've registered that information, and now needing to kind of build up a representation into memory. So you're taking sights and sounds and all of those other things and converting it into things that your brain can understand. So electronic signals and all that kind of stuff. And so this is really kind of presumed to occur with successive presentations of materials. So a lot of the memory tests that we give, it's like, for example, learning a list of words. And so we read the list 5 times or however many times. And so they get those kind of learning trials, and that's when the encoding is happening. So you're slowly kind of, getting this better representation of it into memory. And this is organization of that memory at this stage is very important for being able to retrieve it, and we'll talk more about it later. But there's a lot of really important things going on during this encoding stage. Consolidation is taking that information that you've now converted into something that your brain can understand and then storing it as a long-term memory. So a lot of organization here, and then elaboration on it, making connections. So, I remember this person because they were at this event and they know so-and-so. And so those kinds of connections help strengthen memory so they're not just isolated. It's really getting it so that you can better store it into long-term. And so the way that we look at this, as far as neuropsych testing, so we do, like I mentioned, those couple trials, and so you do the couple trials, and then after like 15, 30 minutes, depending on the test, you ask the person to go back and, so how many of those words can you remember now? And so then you compare that to what they were able to learn. And so looking at that difference. So if they were only able to learn 4 items before, how many of those 4 items are they forgetting? If they were able to learn 15 before, how many of those have they forgotten? And so it's just basically, that forgetting piece of it initially. And then retrieval is the process of reaccessing events or information that have been previously encoded and stored. So this is this is really where people notice the problems, because the encoding consolidation isn't always a conscious process, but when you're trying to remember something later, that's where most people's complaints come in. So one way that we assess this is looking at, after a delay, then we ask them to just, how many words did you remember? And then most tests after that then give kind of a recognition thing. So, okay, I'm going to read a whole lot more, whole bunch more words, and then you just tell me yes or no if it was on that list. And so that can help bring back that information. And so if the memory's in there but they're having trouble with this retrieval part of it, then hearing those cues, so like book, oh yeah, that was on the list, and so you can kind of see, so again, the information's in there, but it's a problem with retrieval, being able to bring it back out freely. And retrieval and encoding they're highly connected, because if something's not encoded and organized correctly when you first learn it, it's going to be very hard to retrieve it later. And so that's where a lot of intervention strategies can be helpful, is just helping the person to learn to organize things more effectively as they're learning it, so that the rest of the process isn't quite as tedious. You will hear sometimes short-term or working memory, and really that is more of that very short-term, so not actually what most people think of as memory. So remembering a phone number to be able to dial it again, but then the phone number's gone, so you're not remembering it long-term. But as far as long-term memory, you have explicit and implicit as one division. So explicit is memory that conscious recollection. So that's further divided into episodic memory. So remembering personal events, things that happened, last week, conversations you had earlier, remembering a birthday party last year, things like that. Semantic memory is more general knowledge, so things that you would learn in school for a history test, or words and their meanings, different kinds of factual semantic knowledge. And so these parts especially, this is, again, what a lot of our testing looks at, a lot of where people report problems, and especially in hypothalamic hamartoma, the structures that are important for this type of memory in particular are that mesial temporal lobe, so the amygdala, the hippocampus, everything that we looked at before that's really close to where the hamartoma is. So, so those are that's very important for just kind of being able to function. And so that's where a lot of, when we talk about like interventions for milder memory deficits, this is where a lot of it is focused. So implicit memory, on the other hand, is basically the key thing about implicit memory is that the person is unaware that they're using the system. So this is things like priming. So you've seen something before, and even without realizing that you've seen it, that it kind of primes you to remember something else. So cueing almost. And then procedural memory, like so learning to ride a bike. I mean that this is where that comes from. So it's kind of, even if you think I haven't ridden a bike in 20 years, there's no way I'm going to be able to remember how to do it. It's not something that you consciously have to know you know how to do. But when you get on the bike, then you can still pick up and go, even without realizing that you knew the steps to do that. And so implicit memory is really important in a lot of memory rehabilitation settings, because this involves different parts of the anatomy. So more of the premotor cortex, basal ganglia, cerebellum, different parts of the brain that, so it's not as affected by damage to the hippocampus or those medial temporal lobe structures. And so this is something that we really capitalize on in rehabilitation. So implicit memory, when you go to a neuropsychologist and have an evaluation, this often is not looked at. It's somewhat harder to test, but for the majority of people that don't have significant memory impairments, the system isn't as important. And so a lot of the times when you hear outcomes in research studies and the results of your neuropsych evaluation, that implicit memory isn't what's talked about as much. It's more the explicit memory. So to jump into intervention strategies now. So we have different types. So task-specific approaches are for more severe memory impairment. And then there are also memory strategy training techniques that are more for mild to moderate. And then some compensatory strategies that can be used across the board with appropriate supports. And then we'll talk about just some general tips. So errorless learning is one of my favorite techniques. So the goal is to not allow the person to make a mistake, because the theory is that they can then learn and code those mistakes. And so we only want them to be learning the right way to do it. So this is very different from how it happens in school, where it's like quizzing and trial and erroring. And a lot of parents will do this when they're trying to help their kids, but quizzing is not always helpful. And so we really encourage parents not to do that. So what's the date today, and what's your teacher's name, and all of that kind of stuff. Really starting with this. So my name is Miss Smith. What is my name? Or next you have occupational therapy. What do you have next? So really just getting them so that this information is learned, but without them learning the incorrect ones and trying to guess, because their memory system isn't capable of doing that. And so really providing this errorless paradigm is really helpful. So it can be used, again, it's more for task-specific things, and it's not good when you try to generalize it, but you could do it for a variety of behaviors. So steps in completing a task, recalling a phone number, again, very specific things. But you could also, so this is a very simple example here, but you could say something like, okay, when you pick up the phone, you say, hello, my name is Sarah. And what do you say when you pick up the phone? And so it's immediately. So it can be used with you can use with a lot of different strategies, but you have to kind of reteach every time. Then spaced retrieval is essentially errorless learning, but instead of asking, what is my name, immediately after you tell them, you slowly kind of increase the response, the time between when you ask them. And so by increase it, I mean, I'm talking 15 seconds, maybe going down to 5 or 10 if they're having trouble. So really slowly increasing it. And if they're making mistakes and not remembering, then you back down on the time. But this, so you start with immediate and then kind of space it out so that they're able to kind of keep this information in their memory for longer periods of time. And you should, as the airless learning starts to work and the information becomes more ingrained, then you should be able to space the retrieval period longer and longer. Chaining is another strategy. So in the simplest terms, this is, if you have to take medication, you put it right by the toothbrush, and so it becomes associated that whenever you brush your teeth, you see the medication and know that you take the medication. So it's kind of building cues on routines. And so to do this, you can kind of break down a specific task into its component parts. So brushing your teeth, you first put the toothpaste on the toothbrush, then you run the water over it, then you brush. So you break everything down into very simple terms. And then you work through so you demonstrate the whole thing first, then you work through the first step, and you practice that first step over and over and over until they've gotten it. And it's very simple pieces. And then you add the second step. And then the third step after they get that. And so it's the completion of step one is the cue to start step two. And so again, if you asked most patients that you would use this with, they wouldn't necessarily be able to just tell you all the steps to brushing their teeth. But as they're going through and doing it, then it's just, they go ahead and do the next step without even knowing that that's what they're supposed to be doing, if that makes sense. Memory strategy training. So this is more for mild to moderate memory impairment. Some of this can be pretty time consuming. And so it may not be as helpful for things you only need to remember for a short period of time, like a grocery list or something. But for information that needs to be more readily available, so names of relatives or other, things that you would actually need to store for a longer period of time that are more important, this can be really helpful. So some association techniques, so using visual pegs. So this is, you link the items that you want to remember with a set of peg words that are already learned in a fixed sequence. So 1, 2, 3, 4, 5, and you can use like words that rhyme with that. So 1 bun, 2 shoe, 3 tree. So say you're trying to remember a grocery list. So the list is bread, gum, and Gatorade. Okay, so 1 bun, and that makes you think of bread. Then 2 shoe, so if that's gum, then you can imagine, your shoe stepping in gum. 3 tree, so if the third thing is Gatorade, then you can imagine pouring Gatorade on the roots of a tree. So it's all very visual, and it can be as silly as you want. You have to use a little creativity, but kind of the sillier it is, the more likely you are to remember it. And so then these sets, you already know, 1, and the rhyming makes it easier. But so 1 bun, okay, and then you can, think of the bread. And so you kind of use things that are already, deeply ingrained in there and associate it with a new list of things that you're needing to remember. So the method of loci is the same idea, except instead of a list of like 1, 2, 3, 4, 5, you would use you link them with a set of items in visual order. So a lot of people will use their bedrooms and remembering, like thinking of all of the pieces of furniture that are in their bedroom. And you go through, and the key to this is being able to remember a list of these things in the same order. So, whether it's right to left or whatever. So here's my dresser, here is a bookcase, here is a bed. And so you come up with a list and you say it in the same order every time. And then you can use that the same way as the visual pegging thing. So, you associate the dresser with something, and then you associate the bookcase with something. And so, so then you can kind of picture going through your room, somewhere that you're very familiar with, and drawing up these connections. And then there are also so organization techniques, and again, the organization is really important for being able to retrieve information more effectively later. And so things like mnemonics, so we all know Roy G. Biv or Every Good Boy Does Fine when you're learning the music keys, so those types of things. Again, as long as you can remember the mnemonic then, so these tend to work better for mild to moderate as opposed to severe impairment. And then semantic clustering, so that's, again, kind of organizing information in a way so that it'll be easier for you to remember later. So a phone number is a perfect example. So instead of trying to remember 7 or 10 digits all at once, it's broken down into the 3, 3, and 4. And that's exactly why it was done that way, because it makes it, instead of having to remember, so if you have a list of, 16 items, they're animals, colors, and foods. Instead of having to remember all of those 15 items, if you can group them, learn them, and group them into those 3 categories, then that kind of cues you. So really, instead of 15 separate items, you're learning just, 5 groups of, or 3 groups of 5. So it's, that can really be very helpful as well. And then compensatory strategies. So again, these are, it's easier to do these with mild to moderate memory impairment because the person has to be able to remember to use a calendar or a planner or organizer. And so there are ways that you can modify it where an alarm goes off, automatically reminding them to check their memory notebook or their planner. But so these are just different ways to kind of help yourself keep organized, things that really all of us would benefit from as far as improving memory. But checklists for how to do things, that can be, checklists for, your routine before you get ready for bed at night, or things you have to do for the day, all that kind of stuff. And then electronic devices, so whether that's an iPad or a watch with an alarm or anything like that. So there's lots of different compensatory strategies, but the important thing for all of them is just it has to be something that the person will actually use. So would you prefer to carry around a notebook and a pen, or write everything, in the notes section on your phone? So it has to be something that they're willing to use and that is easiest for them. And so all of this has to be highly, highly personalized. And then just some kind of general tips. Again, the organization is key. And so the more that you can help with that organization, whether it's outlining things or bullet points or semantic clustering, whatever you can do to help organize that information when it's first going in, it will be easier to pull it back out later. Use multiple modalities. So whether that's visual, verbal, auditory, and a lot of times the neuropsych testing can help kind of figure out what an individual's strengths and weaknesses are. So if someone's more of a visual learner, then strategies focused more on pictures and diagrams will be more helpful than words. Make it meaningful to them, so drawing, connections with other past experiences that they've had, or other ways to kind of give it more meaning for them. Frequent review and rehearsal, and also spaced out. So this is the, cramming for something, cramming for a test never works, and it's absolutely the same thing, but more important here. So frequent and spaced out reviews. And then supporting attention again, because attention is kind of the very first step, and if you don't have that, then memory is going to be significantly impacted. And then just healthy lifestyle, so getting enough sleep, exercise, eating right, all of those things really can have a big impact on memory and attention and all those other things that can help support memory.